Hey there, welcome back. Quick question. When you imagine fatty liver disease, do you picture middle-aged adults knocking back too many cocktails? Most of us do. But here's the shocker. Non-alcoholic fatty liver disease, or NAFLD, is now turning up in kids on every continent. And many of those kids feel perfectly fine. No pain, no yellow eyes, no clue. Wild, right? Now, here's the twist that blew my mind. Part of that risk can be planted before a child even takes their first breath. A brand new Finnish study hints that a mom's blood sugar levels during pregnancy may quietly rewire her baby's liver. Let's unpack how that works, and, more importantly, what we can actually do about it. First, a quick roadmap for today. We're going to travel through the so-called first 1,000 days, from conception to a child's second birthday. We'll look at three big pathways: genes and epigenetics, hormones, and the gut microbiome. And then we'll wrap it all up with practical takeaways you can start using tonight. Sound good? All right, let's dive in. Section 1. The 1,000-day window. Think of these first 1,000 days as the body's grand opening. Organs are still figuring out their long-term jobs, wiring themselves to the nutrients and hormones they're swimming in. Researchers track this by combining fetal ultrasounds, baby growth curves, MRI liver scans, you name it. By comparing siblings and following families for years, they can tease apart what's temporary from what's long-term metabolic reprogramming. Here's the headline: maternal weight, blood glucose control, and early feeding patterns don't work in isolation. They interact, sometimes multiplying each other's impact. The cool part? That means small improvements at several points in this window can add up to a meaningful drop in future liver scarring. Section 2. The three pathways. 1. Epigenetics, your body's sticky notes. Epigenetics is the study of chemical tags that sit on top of DNA, turning genes on or off without changing the code itself. In liver cells, those tags decide how much fat gets burned versus stored, and how well the liver listens to insulin. Studies of cord blood and placental tissue show distinct epigenetic fingerprints in babies whose moms had more inflammation or lousy sleep. Everyday choices, yes, even sleep, can leave marks that persist into adolescence. Let that sink in for a second. 2. Hormones, the body's text message system. Pregnancy alone shifts levels of leptin, adiponectin, cortisol, thyroid hormones. The list goes on. Pile on elevated stress, circadian chaos, or exposure to hormone-disrupting chemicals from plastics and pesticides, and the balance tips further. Later on, school-age liver scans have linked those prenatal hormone wobbles to subtle changes in liver stiffness and blood flow, long before standard blood tests wave a red flag. 3. The gut microbiome, the neighborhood in your belly. Newborns pick up microbes from the birth canal, skin, and basically every surface they meet. C-sections, antibiotics, household diet, even the family dog all shape that mix. Some microbes pump out short-chain fatty acids, bile acid derivatives, even small amounts of ethanol that ride straight to the liver through the portal vein. Kids with lower microbial diversity, or an overgrowth of ethanol-producing bugs, show more liver fat and inflammation on MRI. Section 3. When factors collide. Scientists aren't looking at these influences one by one anymore. They're building complex models. Picture this: air pollution, suboptimal sleep, and a highly processed toddler diet hitting at the same time. Early data says the combined punch packs more wallop than each factor alone. That's why prevention strategies now come in bundles of small, doable tweaks instead of a single magic bullet. Need a mental image? Think of the liver as a research lab setting up for a decades-long experiment. During pregnancy and infancy, the lab orders equipment, enzymes and receptors, hires staff, immune cells, and writes protocols, metabolic pathways. Once the setup is done, teenage habits run through that system. If the lab stocked tons of fat storage enzymes but skimped on fat-burning gear, the exact same snack routine will lead to more liver fat. 2 kids, same chips, totally different outcomes. Section 4. Shifting the starting line. Here's the key takeaway. This isn't about blaming parents. It's about shifting the starting line. NAFLD doesn't suddenly appear in the teen years. The groundwork gets laid far earlier. So public health needs stronger prenatal care, better access to maternal nutrition support, and fewer added sugars in toddler foods. Have you noticed more no added sugar labels in the baby aisle? Expect that trend to keep climbing as the science piles up. Practical questions for you. Before next week, mull over these 3 questions. What's one sugary drink or ultra-processed snack you can swap out this week to support a future baby's liver? Maybe it's trading soda for sparkling water with a squeeze of lime. If pregnancy is on your radar, or already happening, how can you use your next prenatal visit to ask about fatty liver risk? Jot down questions on healthy weight gain, blood sugar checks, or safe exercise, and bring them along. What's one change you can make in your kitchen right now, like putting fruit and high-fiber snacks front and center and tucking soda behind the milk, that makes the liver-friendly choice the easy default? Stick the landing. So, here's what we covered today. First, the 1,000-day window is the liver's calibration phase. Tiny tweaks during pregnancy and infancy can echo for decades. Second, 3 big pathways, epigenetic tags, hormone shifts, and the gut microbiome, carry those early messages straight to the liver. Third, when environmental stressors, poor sleep, and ultra-processed diets pile up, the combined hit is bigger than each one alone. That's why bundled solutions matter. Fourth, your liver is like a research lab set up early in life. Stock it well, and later experiments, think teen diets, run smoother. And finally, none of this is about blame. It's about shifting the starting line so every child's liver gets a fair shot. If you remember nothing else, remember this. Small, consistent choices in those first 1,000 days can tilt the odds toward a healthier liver for life. And you, yes, you, have more influence than you might think. Thanks for listening. If you found value in today's episode, share it with a friend who's expecting, or anyone who buys toddler snacks. And as always, take a deep breath, make one small change, and keep moving forward. Your future liver will thank you.